Hi, we're hoping that you check out our amazing video shot by one of our LASIK patients, giving you the chance to see what LASIK eye surgery is like here at Seeta Eye with Dr. Satish Modi. We offer all the most advanced technologies from SMILE, which is small incision LASIK, to custom, to of course all laser LASIK. Watch the video. If it seems like it's something that you're interested in, please call me here at Seeta Eye. Have a consultation. It's a 1-hour, no cost, no obligation visit. We'd love to help you explore this life-changing procedure and see if it's right for you. Thanks for watching.
No problem.
No one
Please, come
appreciates
have a
more
seat.
than me. I know. A-okay.
Put your bag. You might want to take your jacket off.
It's chilly in here.
Well, you know, unfortunately, the computers and the lasers only work with a certain temperature. So,
No, it's fine. I'm just,
Yeah.
let's go.
I mean, if you want to keep it on, that's fine.
Watch is okay.
Watch is all right. Watch
No
is fine.
phone on you.
Nope, my phone's on my bed.
Yeah, I saw that
Perfect.
already.
Just make sure, yep, it's up.
All right, young lady.
I
Let's get
am.
these boots on.
These are the cutest boots.
Know some of the
There's
things.
my mom right there. How you
Hello,
doing?
how do you do?
All right.
I'm
Miss Archer, nice to
Stacy.
meet you.
You too.
It's like they're obviously going on shape.
Okay.
I'm going to leave you to Dr. Modi's wonderful
This
hands.
is off.
Okay.
You will be
Oh, gosh.
using those only as non-prescription sunglasses once we're done, right?
Yes.
So the first step is I'm going to put an anesthetic drop in your eye.
Okay.
Look up. And it rarely has the same chemical composition as our tears. Look up. Look up. Relax. Good.
Mm-hmm.
And the second time I put the drop in, you'll notice it won't sting, telling you the anesthetic's already working. Right?
Okay.
All right. So once it stops stinging, go ahead and open your eye. Not stinging?
Nope.
Okay. Look up if you would. Close gently. Look up. Close. Now that didn't sting very much, did it?
No.
Okay. All right. So let me tell you what I'm going to do first, and then we can talk about the procedure. So here is a model of the eye. That's what we see between the lids, right? So with the surgical skin marker, I'm going to put a dot at 3 o'clock and 9 o'clock. Because when we lie down, our eyes rotate, and how much they rotate and even what direction they rotate varies from person to person and eye to eye.
Okay.
And it just allows me to treat you that much better. It has a really important secondary benefit. It's going to reassure you, the patient, that I can actually touch the surface of your eyeball, and lo and behold, it doesn't bother you.
Okay.
And that's kind of the psychological thought process I need you to have in your head when you come into the laser room. All right? So let's do that first, and then we can go from there. All right? Hold on to the edge of the table right there, your chin in there, and your forehead right up against the bar. And right now, all I'm doing is just looking and adjusting your head. Okay. You're going to look towards this ear over here, all right? And I'm going to gently hold your upper lid. Don't anticipate. You're going to notice there. Perfect. Hold that. Hold still. You felt me touching you, but did that hurt?
No.
Okay. And you notice how much better you're getting now that you know what I'm doing? Look over here. And that's part of the whole process. Think of them as temporary tattoos that are gone in an hour, all right? Sit back. Wasn't so horrible.
Nope. I didn't
Okay.
feel anything besides
Did-
you opening your eyes.
There you go. All right, so you've got these cute little purple dots. They'll be gone in about an hour. All right, but they'll aid me during the process, all right?
Okay.
All right, so let's talk about what to expect, all right? As you know, we don't use any blades. We're
Right.
using two separate lasers. The first laser is called the Visumax. It's a femtosecond laser. So you've heard of milliseconds and microseconds and nanoseconds. A femtosecond is 1/4,000,000th of a second. It's this unbelievably brief burst of energy, which lays down in a circular pattern literally tens of thousands of bubbles of carbon dioxide and water in your cornea, which coalesce to create the flap. Very safely, very precisely, right? To have that kind of precision, your eye can't be moving. So let me tell you what will happen. You'll come into the room, you'll lie down under the laser, one eye will be covered. I'll hold the lid open with the speculum, something to just prevent you from closing during the process, right? And once I get you in position, underneath the laser, you'll see this white donut-like ring. All right. Your job is to look in the center of the ring, in the center of that donut.
Okay.
That's your beacon. So once it comes close to your eye, you'll still keep, in fact, the green dot will actually get clearer once it docks with your eye, right? But once it docks, you feel a little bit of pressure, nothing more than that, all right? I've had it done to me, and you know what wimps men are, right? It's no big deal.
Okay.
And once we start to the time I come off is 16 seconds. And I'll give you a countdown, 16, 14, 12, 10, what have you, right? And your job is to just basically just keep looking at that flashing green light, all right? So once that's done, I do the other eye. So we'll do both your eyes, make the flap with both eyes under the Visumax. And then we'll sit you up and we're going to walk you over to the wave light laser. That's an excimer laser. That's what reshapes your cornea and gives you your vision. All right? So this time you're going to see a whole mess of different lights. Underneath the laser are these 4 white lights, which really are out of focus here. They're actually like rings of white light. All right? And in the center is a little tiny flashing green light. Again, that's what you're going to look at. I will proceed to raise the flap that we created with the first laser. So that light's going to be a little harder to see, but your job is to look in the center of those 4 white lights. The laser will actually lock onto your eye like the smart bomb technology. It'll actually lock onto the crypts in your iris and stuff, so that your eye it'll follow your eye. You'll keep looking right in that spot there, all right? And I'll start the laser. There's kind of a buzzing sound, funky ozone-like odor. In your case, it'll be over in your worst eye, your left eye, in about 7 seconds.
Okay.
Once it's over, you feel some cool fluid. It's sterile saline. I'm putting the flap back down, making sure the interface is clear, kind of squeegeeing the flap into place. Wait for a few minutes, put a few drops in, we're done. That's the whole process.
Okay.
Totally doable.
I'm ready.
All right. Okay. Any questions?
Nope.
You ready? As ready as you're gonna be?
Yeah.
Okay. No cell phone in your pockets?
Nope.
And no tissues?
Nope.
Perfect. You're gonna come with me?
Okay.
You get to hang out here. We'll be back in a little bit.
See you in a few.
You're gonna sit. Your head is gonna go up towards Tiffany there. Come with me. Now just come back.
Let's get the mask a little
I'm just going to place this on each side because I don't know why you're on the
So Tiffany's just going to clean you up a little bit. All
Go down
right.
towards
Some
your
more
feet.
anesthetic drop.
Yeah,
Didn't really sting, right?
close. That's
Nope.
stinging enough. Then you're going to look
good.
up towards the top of
And
your
remember, speak to me. Don't go shaking or nodding your head.
head. Close.
Okay.
Yeah,
Look
that's
up again.
important.
How's that?
That's good.
Okay.
Thank you.
And I'm gonna give you a ball for each hand here. You're gonna squeeze those instead of squeezing your eyes.
Now you're going to feel
We
some.
want to make sure that we've got them cleaned. And so we're going to cover up the eye we're not working on right now. We're going to start, we always start with the right eye first. All right, so we're going to tape the left eye shut and we're going to put a little shield over it so that the eye we're not working on is covered. All right. Simply move the bed into position. Okay, and I'm just sort of slowly moving your bed and your eye into the proper position. So that's the treatment. Let's just verify that's correct. Patient ID. We're doing the right eye first, so that's the right eye flap. Excellent. This is the 100 microns. We're using the small pack. Check. Open your eye. Remember I told you we're going to be using a little speculum to hold your lid apart. Try not to fight it. That's as bad as it gets. Excellent. Now, do you see the white donut-like ring there?
Yes.
All right, so that's where you're going to move. Look, I'm just gently wiping your cornea nice and clean. Keep looking right at it. And in a moment, and there you go. You see the flashing green light there?
Yes.
All right, so your job is to look only at that green light. All right, nowhere else.
And then squeeze what's in your hands. Nice gentle breath.
Excellent.
Suction on.
So we're in perfect position. Keep looking right there.
Ready.
The laser has already begun. You keep looking at the green light. We've got 15 seconds left. Perfect, perfect. We've got 4 seconds left. Beautiful, well done. And that was the extent. I mean, the pressure was not horrendous, right?
Safe distance.
Okay, so we're now gonna program the next eye. So let's get this out, if I can just give that to you. We're gonna cover up the eye we just did. I'm gonna turn your head just
Check.
So left eye, parameters are excellent, check. And we're gonna use the shield and just put that over this eye.
Release.
Please, thank you. So we have another patient interface for your left eye. I'm just getting that in position. Excellent. Open your left eye, please. We're going to use the same speculum. That's excellent. And that's the extent of it. No squeezing. No squeezing. Look right at that white donut. You're doing great. That's perfect. Excellent. The laser is going through its programming. You'll see the green light. Do you see it now? Yes?
Yes.
Okay, so nice and still. Hold that position.
Suction on.
So you're in perfect position again.
Ready.
The laser's already begun. We're 15 seconds away from being done. Continue to stay nice and still. No squeezing, no squeezing. Beautiful. You're going to lose the light for 4 seconds. Keep looking right where you were. Marvelous. Absolutely fantastic. So we're going to take the speculum out.
Safe distance.
And we're ready to release that whenever you're ready.
Release.
Got it.
So the table's going to move out. You keep seated exactly where you are. And then we'll move you over to the next laser. You did that marvelously. The pressure wasn't really bad, was it?
No,
Okay. Did you lose the green light at all?
I did.
For what? The last few seconds, like I said, right?
Yes.
Yeah, okay. Was that a problem in terms of how you looked?
No.
Yeah, I didn't think so.
You did go home with 30 degree.
I'm gonna have you lift up your legs for me.
And I'll take those squishy balls back from you. Thank you. You're gonna sit up and swing your legs to your right. So sit for a second, feeling dizzy, lightheaded at all. It's kind of like you're underwater.
No.
Okay. So you're gonna sit in the middle of the bed, your head is gonna go up to your right. Again.
Legs. Okay, and now I'm gonna move you underneath the laser in just a moment.
The vario readings are in. We're doing a minus 250 ablation with a 6.5 millimeter optical zone and 100 micron flap thickness.
Check.
All the information is in. Confirm.
Confirm.
So, just like I explained, we're going to be using the speculum again, right? And you're going to hold your head just like so. I'm going to ask you to open your eye. And that's it. That's the extent of it. You see those 4 white lights that like a circle, and then you see the flashing green light, do you not?
I see green and red.
Yeah, forget the red. The red is from eye focusing. All right, the green light is what you're going to look at. So I'm just going to get you used to the sensation of being touched here. Excellent. All right, so what's going to happen now is we're going to start the process of registering you, and then I'm going to actually raise the flap, all right? So when I raise the flap, that light will appear to you like it's moving.
sell you this?
I don't think we should elevate it here. So what I'm going to ask you to do next is, without moving your head, look down. Excellent. Keep looking down there. I'm raising the flap here. Now look right at the lights. We've got a gorgeous flap. We're just going to measure it.
Done. 441.
You notice what I meant, right? The green light has become much more difficult to see. Would you agree?
Yes, I can't see it. Oh.
Well,
see
you
it once
will
at a
see the.
time.
Let me just get a few moments.
37.
Okay. Are we ready to? Take a
Turn that
deep.
down.
Take your deep breath for me.
Got it.
Got it? Excellent. Ready for center test?
Confirm. Equal centered. 6 seconds. Laser ready. 4, 2. Done.
That was it. You're going to feel some fluid. Now, just keep looking right there. Raise the light for me, please.
Good there.
A little more. No, look right at the lights, the white lights. Look right in the center. There you go. Excellent. Let me get
Lifter.
the lifter. Thank you. Thank you. Bear with me. Bear with me. I know that fluid is more bothersome than the actual laser, isn't it?
Yes.
But I'm just cleaning the interface. I'm making sure everything is where it should be. Thank you. No, keep looking right at those lights. They'll intermittently get out of focus. I'm just checking the interface, making sure everything is where it should be. Excellent. Beautiful. Remember I told you I was going to squeegee the flap, if you will?
Yes.
That's what I'm doing right now, just making sure it's free of any folds, that it's sitting right where it should be. What the first laser does, unlike a blade, is that it creates almost this microscopic manhole cover. So the flap really, not keep looking straight at the lights, sits beautifully where it should be. And this is the reason why you folks in the armed services and everything can have this procedure, unlike in the old days when you couldn't have LASIK, you had to have PRK. It was only after all laser LASIK that the Marines and the Navy SEALs and people in the armed forces were allowed to have LASIK. So we are literally a couple of minutes away from being done. Everything has gone superbly. You notice you can see the green lights again, right?
Yes.
And while we're waiting, I'm just going to put another anesthetic drop in your left eye. You keep looking at those lights. Keep looking right there at those lights. I'm going to turn the light down a little bit for you. All right, so while we're waiting, we're looking at the parameters for your left eye, minus 3 1/4, 6.5 OZ. Excellent. Okay, confirm. Okay, let's get the drops in, and we will be done with the right eye. It's gone superbly. A steroid, a non-steroidal anti-inflammatory, kind of like an ibuprofen drop for the eye. Keep looking right at the
I know, I
light,
just blocked the
right
vision,
straight
sorry.
ahead. Excellent. Well done.
That's good.
So let's cover up the eye we've just done. So let's have you open your left eye. I'm going to use the same speculum. And it's essentially a repetition of what we did with the other eye, right? So there are no surprises. Just keep looking right at those lights. Great. Again, I'm going to raise the flap so that light will appear to you like it's moving. Bear with me. Okay, so without moving your head, look down, please. Keep looking down. Excellent. Now look right up at the lights. Again, a gorgeous looking flap. Let me just measure it.
Done.
I'm going to
4:45.
clean the bed and make sure it's nice and dry to receive the laser. Ready to
Turn light up, please.
take a deep. All
Confirm center.
right. So let's confirm center.
Correct. Confirm center. Repeat. Equal centered. 5 seconds remaining. 3, 1, done.
And that was it. You're going to feel that fluid again. Raise the light for me, please. Thank you. Beautiful. So just checking the flap again. Bear with me. Excellent. Thank you. And just making sure the flap is nice and free of any folds. Alrighty, all we have to do is just wait for a couple of minutes and we will be done with the process. I'm turning the light down. We'll just put those drops in and I'll take the speculum out. You did marvelously. Everything went very well. Just keep looking right at that flashing green light if you be so kind. Perfect. We've got about a minute to go, all right?
Yes.
Good, you remembered not to nod.
Great.
Yeah. So some of those milky drops coming up again. Excellent. Keep looking at that green light. Lovely. Close. We are done, young lady. All right, so we're going to now get you out of position. So. Your knees. You aren't feeling dizzy or anything, right? Does how you sit up, legs to the left. So stay seated, make sure you're not dizzy or moving. A little different from that first laser, huh? Back into the room, shall we? There we go, right this way. It's a little bright out here, all right, so.
You're actually already doing your job, what you need to be doing today, which is keeping both eyes closed as much as possible. You can open your eyes to get to the car, to eat dinner, to get up to go to the bathroom, but largely you're keeping both eyes closed. You can have a seat, ma'am. When you do open and close your eyes, look at me for a moment. I want you to do these exaggerated blinks. Close and open. Don't try to wash tonight, nothing like that. You'll leave here with plastic shields literally taped on you. We'll show Mom how to manipulate them.
Okay.
And we'll put some sunglasses on top of that. And you get to go home and sleep the day away.
Okay.
So no texting, no phone, no TV. It's just about being horizontal, eyes closed, and letting everything heal.
Okay.
But I'll never stop being amazed at how good your eyes look already, with surgery only been moments ago. How you doing?
I'm good.
Excellent.